Cancer, as we all know, has a devastating effect on human body. But with recent advances in research, there are a lot of preventive measures. We can identify it early and treat it. This is what constitutes preventive oncology. Today I'll be briefly discussing about the preventive measures for cancers affecting the women's reproductive organ, namely the cervical cancer, the ovarian cancer and the uterine cancer. So the first one would be the cervical cancer. So what is cervix? Cervix is the lowermost part of the uterus or the womb, and the cancer affecting that is the most common gynec cancers. So one woman dies every 8 minutes due to cervical cancer, and almost all of these cases are caused by a sexually transmitted infection called the human papilloma virus. So not all infection causes it, but only a few high-risk strains, namely the HPV 16, 18 goes on to produce cancer. But the good news is we can completely prevent this infection from happening. How do we do it? Yes, there is a vaccine called the HPV vaccine. It's nearly 90% effective in preventing the infection if administered to a girl before her sexual debut. So based upon the recommendations, HPV vaccine can be administered for girls from the age of 19 years as 2 doses for up till 14 years and 3 doses later on. And the second good news is cervical cancer has a very long latent period, that is about 15 to 20 years from the infection till the cancer development. So here comes the importance of screening. So what is screening? So these are a few medical tests or procedures which can be applied to a woman who is completely normal without any symptoms at a regular interval, so that we can identify precancerous and cancerous lesion at the earliest. So for cervical cancer, we have effective screening, that is pap smear and the HPV testing. So this has to be done by every girl or woman beyond 25 years and if she's sexually active up till 65 years of age, either by a pap smear once in 3 years, or the preferred is the pap plus HPV testing once every 5 years. It's a very simple office-based procedure done in about hardly 5 minutes. So what if it is abnormal? Nothing to panic. We have a further diagnostic test called the colposcope, where the cervix, the vagina is examined under magnification. If any abnormality detected, we can take a sample for the testing. So the second cancer is the ovarian cancer, which is the most lethal among the gynec cancers. It's also called the silent killer. Why? Because nearly 75% of the women present at an advanced stage. So what do we do so that we can prevent it? Though we cannot completely prevent the cancer from happening, but there are certain behaviors which can whereby we can reduce the risk. So if anybody has a high personal or a family history of ovarian cancer, breast cancer, colon cancer, we can advise them to go for genetic counseling and to identify if there's any mutations like the BRCA1 mutation, BRCA2 mutation. If so identified, there are provisions of prophylactic surgery, that is surgery which can prevent the cancer from happening. I'm sure all of you would have heard about Angelina Jolie undergoing surgery, that is prophylactic breast removal, ovarian removal, when she had this mutations known. Similarly, the other behaviors like breastfeeding or having a tubectomy once the family is completed, or the birth control pills reduce the risk. And in those women who are at a higher risk, they can go for screening by the annual surveillance with a tumor marker or this blood test called the CA125 and an annual ultrasonography. So the third cancer which I would like to talk is the uterine cancer, also called the endometrial cancer or the cancer of the uterine lining. So this is a lifestyle dependent cancer. Means women who are obese with other comorbidities like diabetes, hypertension, who have high cholesterol levels, this places a woman at a high risk. Though there is no effective screening method, but these women usually present at a very early stage. What does that mean? That means usually if any postmenopausal women who has a bleeding or a spotting, or women who are approaching menopause but who have irregular bleeding or a very high bleeding, they have to report to a doctor immediately. We at Aster have facilities called a flexible hysteroscope, where we can look into the uterine lining, identify if there's any abnormality and take a sample, which brings about very little discomfort to the patients. So I would like to conclude my today's topic by an age-old saying, prevention is better than cure. So I would like to emphasize that knowledge is power. So all women need to be aware. They have to understand their risks so that they can go for annual surveillance or screening, and that is the most crucial point. So we at Aster International Institute of Oncology, with our team of experts, we sit down with the patients. We have also the facilities for the latest screening, prevention and treatment modalities, novel surgeries for both the precancerous and the cancerous surgeries. Thank you.